We launched our Nursing Now campaign earlier this year, and we were delighted to have Professor Sir Michael Marmot join us.
Nurses are trusted people, and they're trusted for very good reasons. And that means that trust, which has been well earned, can then be used in the service of improving health and reducing health inequalities.
One of the biggest challenges of our time and an indictment of our society is homelessness. That's why I've made it one of the key priorities under Nursing Now.
Working as a nurse in the health and wellbeing team, I have a great opportunity to advocate on behalf of people who are homeless. I work to inform practice and policy by developing and implementing appropriate care pathways.
Our vision in Northern Ireland is to transform our health and social care system by promoting health and well-being. We want to make sure that every person has the best start in life from the moment they are born until they are ready for school, throughout their whole education until they reach their working life as adults, retire and into old age. The way we will do this is through prevention, early intervention and supporting health and well-being.
As a school nurse, I provide health appraisals for the school-age population. We provide a healthy weight pathway which targets obesity. We provide teacher training. We also are involved in safeguarding and immunisations.
All nurses and midwives have a responsibility to protect and improve the health of the population.
All pregnant women had their carbon monoxide levels read at their very first appointment, and since then that has given midwives an excellent opportunity for early intervention in discussing with mums about how best to protect their unborn babies. And it's a wonderful opportunity for me to talk to them about becoming a smoke-free family.
Nurses make a huge contribution to care and our society.
Nurses are often the first and sometimes the only health professional that people see.
And the quality of their initial assessment, care and treatment is vital. They are also part of their local communities, sharing its culture, strengths and vulnerabilities.
District nurses based in the local community are ideally suited and perfectly placed to act as ambassadors for older people in the public health arena.
They are a voice to lead and to deliver effective interventions to support patients, families and communities.
It is extremely important that nurses and midwives remember to look after themselves first and foremost. Looking after your own health and well-being is the biggest and hopefully the longest project you will ever be involved in. Next year, 2020, is the year of the nurse and the midwife. Let us all make plans to ensure that nurses and midwives are visible and valued.
Finally, I would urge all nurses and midwives to grasp the opportunity to lead the transformational change in all of their countries that will help to improve outcomes for the populations they serve. Every day is different. You're pushed to your limits, but you go home knowing you've made a real difference. As Florence Nightingale said, "They may forget your name, but they will not forget how you made them feel." Nurses, in my eyes, are the holders of hope, the champions of change and the voice of the vulnerable, and they do amazing things every day.